Wanted to do a quick video on pain and outline sort of the kind of pain most people experience in day-to-day life and how it's treated. The first of two main categories is nociceptive pain. This is the fancy word for pain caused by stimulation of pain sensory apparatus on the body. The most common examples being something like a cut, right? Or you get an injury of some kind. The pain sensors send a signal to the brain, and the brain interprets that as damage that needs to be addressed, which is why it becomes so overwhelming to you. The second is called neuropathic pain. This is the kind of pain that's caused despite not having some clear damage to or setting off of a pain sensor system, and instead is thought to be due to damage or some incident caused on the pathway leading up to the brain. A great example of that is the funny bone that no one finds funny. By pushing on that exposed nerve, a signal is sent up despite not actually having injury at a receptor site. For nociceptive pain, for pain that is at a site with clear injury, one of the really common reasons we start to feel more and more pain is due to inflammation. And that's why anti-inflammatory drugs, over-the-counter stuff like, Advil or aspirin, work really well for that kind of pain. In contrast, when you have neuropathic pain, those drugs often don't work as well because there is no inflammation to decrease and improve the experience. That's often when the opiates come into play, when you start taking things like hydrocodone and Percocet, and we all know about the issues surrounding those, but I'm just outlining why certain drugs are selected over others. In other instances, if the peripheral pain is severe enough, the injury is really bad, you can also imagine that adjusting just inflammation is not enough, and that is again why you see both drugs often being used. A great example being Percocet, which is both an opiate and an anti-inflammatory type drug, typically Tylenol. And I know that's not technically an NSAID, but I'll talk about that more in another video. Anyway, hope that's helpful. As always, please follow, like, and comment with ideas for future videos.